everyone, this is Dr. Drew from Warner Chiropractic Care Center, and today we are going to be answering the question, when do I need an X-ray or MRI when I have low back pain? Okay, let's get to it. Before we answer this question, let's provide a little bit of background on what the purpose of an X-ray or MRI is. X-rays allow us to see bony abnormalities within the body, and an MRI allows us to see the soft tissue abnormalities present in the body. So if a bony abnormality is present, such as a fractured bone, one of the best ways we're able to visualize this is through an X-ray. If there is a suspected soft tissue abnormality, such as a disc bulge, one of the best ways we're able to visualize this is through an MRI. So when is an X-ray or MRI necessary? According to the American Academy of Family Physicians, a doctor should not be ordering an X-ray or MRI for someone with low back or neck pain within the first 6 weeks of care, except for a few exceptions. I'm going to be breaking down these exceptions into two categories. So first, we have the additional symptoms that require imaging in almost every circumstance. And then secondly are the additional symptoms that, if present, may require imaging depending on the interpretation of the doctor when present with low back pain. If you are experiencing low back pain with a sudden loss of bowel or bladder control, and then also are experiencing numbness or tingling in the region depicted next to me, then an MRI is needed for an immediate referral every time. Additional symptoms that the doctor will need to determine whether they're relevant or not include low back pain with a fever, severe trauma, sudden back pain with tenderness over the spine, especially in the cases when the patient has a history of osteoporosis, cancer, or excessive corticosteroid use, or a serious underlying medical condition. If none of those additional symptoms are present, then the doctor doesn't need to order the X-ray or MRI right away, and they can proceed with going through a trial of care for up to 6 weeks before X-ray or MRI should be considered. For those of you that don't quite understand what a trial of care is, don't worry, I'll give you an example of how that would work in our office. So the treatment interventions we typically utilize for low back pain is spinal manipulation, and then we'll also do exercises specifically geared toward helping with low back pain. So at each visit, we are evaluating how the patient is responding to our treatment plan. Now, we're not just looking at pain, but we're also seeing how the patient is functionally improving as well. So those functional improvements could be related to the goals that we set on our first visit. So some of these things can include if the patient was struggling going on long walks, and because they've had low back pain, they haven't been able to do that as much. We'll see, okay, maybe you haven't been able to go on as far of a walk as you had in the past, but let's try maybe going for short walks, maybe just 100 yards down to the end of the block and back. So after all these tweaks that we make to their treatment plan, and if the patient isn't getting better after 6 weeks, we may need to order that X-ray or MRI to get more information. And then based on the findings of the X-ray or MRI, we may even need to make a referral to a pain clinic or also a neurosurgeon for a consultation. Okay, so what did we learn today? For an X-ray, we're able to see the bony abnormalities in the spine, and then for an MRI, we're able to see the soft tissue abnormalities in the spine. An X-ray or MRI is typically not needed within the first 6 weeks of care unless those exceptions we discussed earlier are present. Or if they have been receiving care for 6 weeks and they haven't improved either from a pain perspective or a functional perspective, then an X-ray or MRI is indicated. I hope you guys enjoyed this video. We're going to be uploading videos like this one every week, so stay tuned for more videos. And if you have any questions or concerns, or if there's any topics that you would like us to discuss in the future, feel free to post them in the comments. Okay, we'll see you next time.